tell me about your shoulder. What's going on now? And tell me.
Right now, it's right here in the front. And it's a deep pocket burning is what it always feels like. Like I push on it, that's I can feel that spot exactly.
Got it. And how long has it been going on?
Decade.
Yeah. Any sort of specific injury that brought that on?
It's falling out of a tree through my chainsaw. Because I was up the tree cutting limbs off. And a limb came back, hit me, knocked me out of the tree, up the saw in my hand. So I threw the saw and I got caught in the tree on my way down because my safety harness, but I didn't want to have the saw in my hand when I was swinging. So
For sure.
So it was that quick throwing when I was flying backwards that that's when it started.
Got it.
And then over years, there was a car accident we had a little sports car, rear engine, and it was just that sudden jolt with whiplash and all that. We had treatment from that, and then just recently, just actually last weekend, wiped out skiing, hit an ice chunk coming down a double black, and so I got my face all dinged up. And that it landed hard on that shoulder, so that's pretty much what re-irritated it again.
Got it. Okay. So you know, when I'm assessing shoulders, I start to kind of think about the likelihood of what might be going on. So Dan's instance, he's got multiple episodes of trauma. I think all three of those
waiting to happen. Yeah.
would be trauma, but you know, he gets back in the game, so he's probably got a pretty good healing capacity based on that. What do you do for work?
I sell skis and service ski equipment.
Okay, great.
So test
Really?
drive.
Where?
6 years old.
Oh, really?
Yeah.
Okay. I don't think I've ever met you there.
No, I'm only about 3-4 days a week, but
Okay.
Nice.
I work with Greg Bothner. I don't know if you know him. Back in the corner.
Yeah.
Good.
The older old guy.
Okay.
It's just him and I are the only two of those guys there. Call him the wizard.
Nice. All right, sounds good. So what I'm going to do is, first of all, I'll probably just we'll do an assessment of your mobility.
Okay.
Take a look at your rotator cuff integrity from a physical examination point of view, and then I'll do some special tests, see what might be contributing to that. But you're telling me symptoms.
It's right in this pocket. Right where the muscle meets.
That's you let your arm down.
Yeah, right there.
Okay. Not that.
No, down.
Not there. More in there.
Right in there in the pocket more.
Okay,
Yeah.
fair enough. All right. So just going to observe your movements. If you would, on your left side, you lead with your thumb, reach up and over your head. Any bother there? No. While you're here, I'm going to do a test. Just to allow yourself to relax. Okay, thank you. Reach up your other side, please. He's struggling to get up there, right? So he's got some stiffness in there.
Yeah,
Okay,
it's
back
stiff
up.
all through this whole side.
Okay. And that's not new. That's been with you for a while.
Oh, it's always been stiff.
Okay, fair enough.
Just re-irritated though.
Got it. Okay. And bothersome at the top there?
Up here,
Yeah.
yeah, it just feels tight.
Okay. Relax, allow me to move you. What about this?
Yeah, it feels tight.
Okay. Doesn't bring on your symptoms though.
No, I don't really understand.
Okay. Arm out to the side like a snow angel, please. On this side, if you would, please.
On
the
this
left
side?
Yep. Reach up towards the ceiling with your thumb. Way up, way up, way up. Keep going up, keep going up. And back down. And thank you. And the other side.
Yeah,
You bothersome right there, okay?
right about in there. Yep, that's where it pinches.
And then once you raise your arm up further,
It goes away.
it goes away. Okay, so
Just
it's called a painful arc. So I'm
Yeah.
collecting some data here, right? Collecting some information. All right, now I'm going to have you bring your elbows in. Keep your elbows in and bring your hands out. We're going to test your external rotators of your shoulder muscles. Hold, don't let me move you. Hold. Good strength there. Good strength there. Put your left hand in your tummy. Do it with this hand, please. Put your this hand in your
Left hand,
tummy.
the other left.
Bring your elbow forward. That's it. Hold your hand to your belly. Don't let me move you. Good. So we're checking the subscapularis muscle. Looks pretty decent there. We're going to check a couple other muscles here. Hand back. Smallest of the rotator cuff muscles we're testing here. Hold. Don't let me move you.
I felt that.
Felt that in that shoulder.
Yeah, I felt that in that shoulder.
Hand back. Hold. don't let me move you. Any bother with that? It's not loving that, right?
Not loving it.
Push your hand forward, how about that?
Yeah, I feel that too.
Okay.
Right through the front.
Yeah, so that's a sign of maybe some, what we call instability, right? So we're starting to get a picture of, he's got some stiffness in that area. Could be protective stiffness because it's irritated. Could have some joint capsule stiffness. We're gonna investigate that in a little bit. But he definitely has motor control problems. And his muscles don't know how to keep up with that, for whatever reason, right? I'm gonna check another muscle area, and that's just put your hand here, don't let me move you. Good. And on the other side, hold, don't let me move you. He's
I
forget about it, right?
Forget about it.
Is that painful or just weak?
That yeah, that hurts.
That hurts.
There you
Okay,
go.
so painful and weak, right?
Yeah.
Okay, so we'll take a look at this a little further. Kick off your shoes, please. All right, Dan, if you don't mind, lie on your back. We're gonna take a look at a couple things further. So, sunny side up. Right shoulder. So where was the ski hill incident at?
Oh, if I granted people lost all.
Peak, okay. Next thing is, I'm just gonna check the movement of the ball and socket joint. On his,
Relax on it.
yeah, just relax. I'm just gonna control how much his shoulder blade moves. Ideally, his elbow will move up to his earlobe, bottom of his earlobe, and no problem with that. That hand should go back, so it's could rest on the floor if you were lying on his back. Not much problem there. A little bit here, no bother there. You guys need to get going.
Soon, yes.
Okay. So, I'll be controlled, cool. Okay. Difference right to left there? Little bit.
Yeah. Oh, you're talking to them, yeah.
That's some stiffness. Yeah, you're feeling the
It's
difference.
pretty stiff from that, yeah.
Hand back, doesn't quite get there, right? Here, right? So he's got a mixed presentation, right? He's got significant weakness in one of the rotator cuff muscles. That, or when we test it, that could be as a result of the pain and stiffness in the shoulder joint. It could be irritation in the shoulder, or could possibly be a significant tear. I don't think so, because he gets back into the game, right? Who knows, right? So rotator cuff irritation, stiffness, and then this muscle control problem. If you have stiffness, the muscles don't know how to work. So the first thing I'm gonna do is just a little bit of mobilization of that shoulder joint, see if we can't get it, some sort of release in the muscle here. Okay, do a little bit of work through there. All right, so what I'm gonna do is just a gentle, call it joint mobilization technique. Just let your elbow rest as best you can. That's it. You're gonna feel a shift into that shoulder joint. Thank you, ladies.
Thank you.
Have a great night. Feel bothersome there?
I can feel it, yeah.
Yeah, so he's not loving that, right? So he's not reacting positively to that. We're not gonna do more of that right now, right? Might try to find another approach, or I might try another strategy and see how we do with more of a muscle control strategy, which I think is the direction I want to go. Have a seat, please. So I don't have the advantage of like detailed imagery with this. If I feel someone needs some imagery, we'll certainly get it. And there are some folks who do. You can keep your shoes off. There's some stuff right here.
Okay.
Yep.
On this table?
Oh, you're just gonna stand here, right? But we have this retest. Like I can do an assessment, do an intervention. How does it perform after that? If it's a bit better, if there's a change in the pain or flexibility, then we know, hey, we could maybe do a little bit more in that. He wasn't loving that joint mobilization technique, maybe because he's got more of an instability issue. So we're gonna kind of check that out. Help the muscles coordinate better. So you're gonna just keep your elbow resting right here. Is that comfortable for you?
Right there, yeah.
Okay. Just maintain yourself there. Don't let me move you. Don't let me move you. Good. Any bother with that? No. Good. We're gonna do a little bit more of that. Just giving them light resistance, maybe 5-10 pounds. Nothing too crazy. Maintain yourself there. Don't let me move you. Don't let me move you. Activating his triceps. We're going to activate a little bit of his lat. I'm going to have my hand behind his arm. Don't allow me to move you forward. Good. Some of the muscles that squeeze your elbow in at your side. Don't let me, there we go. We're going to do a little bit the internal rotators. Hold. We just activate some of these muscles here. Now we're going to do multiple directions. So all you need to do is just maintain yourself here. Just match my resistance.
Okay.
So when I back off, you back off. You have to kind of wait until you feel where I'm at. So I'm challenging his nervous system, his central nervous system, to respond to a variable patterning of muscle activation patterns so that he can get better muscle control over this.
Start to feel it twinge when you're pushing on your
A
thumb.
little bit, right?
Yep.
So very light resistance here, right? So
Big much.
I'm thinking he's got a muscular control issue. It's one of his primary issues, right? Doing a little better with this level of muscle
Yeah.
activation. Yeah. So we don't
Yeah.
spend so much time there, a little
Yeah.
bit better. So there's a number of strategies we can do with this, right? We might spend a few more moments in this and then we'll retest.
Huh.
Good. You better go. All right, now, I'm not sure how this is going to turn out, but let's see how the upward reaching is now.
All the way around.
All the way up. Yep. Back down.
Yeah, I mean, I can still feel it's there. It's not as bad. I mean, it's burning. But I feel the, when I get the boy here, you can still feel it, but it's not as, like a hot needle. So
And
I
then-
would feel like,
And then up to the side. All the way up. All the way up.
yeah, I don't feel anything in that way. It
Nice.
feels pretty good. So,
So here's the thing. Structurally, we didn't change anything in the shoulder. Right? So if there's something scary in there, like some sort of bone spur or labral tear, a whole number of things that can be wrong in there, that's not going to change from a muscle activation pattern. So we resort the deck a little bit. His number one issue is most likely a motor control issue. He needs better muscle control so that when he raises his arm, that those rotator cuff muscles know how to respond to that. And yeah, he may have some issues. Potentially we could see if he's got any issues in upper thoracic spine that are contributing to that, or maybe into his neck. But I think for the most part, he's got a motor control issue. So there's a whole wide variety of exercise strategies for that. Usually really good outcomes. So
good to know.
super, Dan.
All
Thank
right.
you so much. Appreciate
Thank you.
appreciate you volunteering your shoulder to science. All right. So in his instance, a plan of care might include some hands-on work. He may benefit from some muscle massage work to kind of stimulate tissues. There's this neurological connection between what one can feel in the body area and how they control their movement. So maybe we do a bit of massage or different tissue work in there to stimulate those tissues to help his brain get a better idea how that area works. Might be a number of coordination type strengthening ahead of that robust strength and conditioning, right? Because you have to get that fine muscle control before you get those big muscles a bit stronger. He's got good muscle mass. I mean, we test his muscles out, not bad, but it's going to take a bit, I think, for those, a number of sessions for those muscles to catch up, right? So we think of different phases in the plan of care. Early on, we want to relieve pain and irritation, right? So in this instance, we probably use an exercise-based intervention. He might benefit from some dry needling, which is anybody know what dry needling is? The use of acupuncture needles in and around muscle nerves and joints in order to improve pain and improve function. That might help calm things down a little bit, but ultimately early on it's going to be a fair amount of exercise. Relieving pain, the next thing is increase the strength development and perhaps look at any postural issues. Looks like he has pretty reasonable posture, but talk to me about his exercise routine, maybe a little bit more push-up based as opposed to working his upper back, so he might have some postural issues there that he could benefit from. And then strengthen within those newfound patterns, and then eventually build up enough strength in enough different dimensions so that he's happy to push, pull, and whatever adventure he's on to in his next activities, right? So what's your next trip you got planned?
Oh, I'm going this weekend. We haven't really picked a spot yet. I'll be either in Michigan or down south. Depends what kind of snow we get here.
Fair enough.
So,
I always say at the end of a plan of care, when we work with somebody, we want to have a nice tight package of a couple of pain relief activities or flexibility exercises, and then a series of strengthening exercises that are going to match the type of things that you want to do.
Mhm.
And that's pretty much it, right?
good to know.
Get you patched up so you don't have to subject yourself to just dealing with it, right?
Yeah, I've been dealing with it. And I guess I wonder if like a scar tissue builds up on a ligament or something from years ago that I don't know, does that happen or?
Well, I think
because I never really had it
yeah.
treated. Well, other than over the counter stuff and the creams, I did a lot of that. A lot of the aspirin creams and stuff. But like I say, it would go away for a while, but then it would be a certain activity or certain movement or something. Or like just carrying my grandson. He's like a 20-pound tank. Just in that one arm, after that position for too long, it seems like it really puts strain on it. So.
Fair enough. So your question is
But can that if there's like a scar tissue on that, how does that? That doesn't really go away. What you strengthen it, does that stay? I mean, will that irritate it like a spur ever? Because it's kind of like a buildup on top of a ligament, isn't it?
as your shoulder improves, its movement and muscle control, the effects of any altered anatomy in there will be minimized,
All right.
if you will.
Yeah.
Right? So it's probably not pristine and clean in there if we sent you through an MRI,
Oh,
right?
probably not.
But your other one may not either, right?
No, probably not. It could go all the way back from when I was wrestling. I could have tore something up back then too. Always something hard on myself, I guess. Keep going. So.
Live life fully, right? That's
Live
the
life
intention of getting back to the
Yes.
point where you're less worried about it, right? So,
Right. I
Get you
don't know
back,
when
get
your
you-
last day is, so I just live every day best I can.
amen, brother.
So.
Right, that's true. So, well, cool. That was good. I appreciate you donating your shoulder to science here.